Hi, I'm your host, Marsha Florence for Just Ask. Today our show is Your Home Health Care Provider. Hurry back and join us. Hi, I'm your host, Marsha Florence with Just Ask. Today our show is Your Home Health Care Provider, and we have Chairman and CEO Bob McPherson. Hi, Bob.
Hi, Marsha.
Glad to have you here.
And I'm glad to be here. Thank you.
Okay, thank you. Now, Bob, we had a call from some of our viewers asking us about home health care supplies, home health care coverage, just a gamut of questions in reference to where do they go, how do they get supplies, and what would be a good route to take to get the things that they need. And I want to ask you, being the president yourself of Home Health Care Services, tell us a little bit about yours, Crystal Home Health Care, and what a person should look for.
Well, Crystal Home Health Care was formed 23 years ago to develop a one-stop shop for home health care. So everything you need, the doctors, the nurses, the therapists, equipment and supplies, you can receive through Crystal Home Health Care. And we participate with all the insurance programs in the metropolitan area. So we're a one-stop shop.
Okay, now when you say one-stop, the person has went to the doctor, got a prescription for some type of device, okay? Could be, well, not so much wheelchair, but could be something like a bathroom shower chair, a lift, and things of that nature. Can they call a place like Crystal Home Health Care and get those things, and what would be the procedure?
Absolutely. Well, they can call us at Crystal Home Health Care for any appliance or device that they would need recovering in their home from an accident or an illness. What we try and do at Crystal Home Health Care is we try and provide everything that is needed for a person to recover in place, in their own home, in their own environment, and with the support of their family and loved ones. And we fill in the gaps. So if they need a nurse to help them recover in place, we'll provide a nurse. If they need a home health aide to come by and help them prepare meals, we'll provide the home health aide. And again, 99% of our services are covered by the patient's insurance.
Okay, now a lot of people don't know that they can get nurses' assistance or a home health care aide under their insurance. Is that something that the physician should write on the prescription? Is it prescription written as well? Because if my elderly mother needs a nurse's aide, and we don't know that the nurse's aide billing is covered under the insurance, how would they do that?
Well, most of the time when you sign up for an insurance program, they give you a list of what your benefits are. And it's really incumbent on the patient or a loved one to have someone in the home that coordinates the information. You know, so like in my home, my eldest daughter, who the business is named after, Crystal, she coordinates all that. So if my mom needed a service and she didn't know of Crystal Home Health Care, she would call a competitive service and arrange it there. But normally, in America, it's on you.
Bob, I understand that if you have a loved one, if you have one that's informative like that. Right. But a lot of our population, such as the elderly and the disabled, don't have someone that may be the spokesperson for them. Right. So my question to you is that if I'm sick and I said, well, you know, I'm only child and I've got to get some things in my home to equip me with. Do I have this conversation with my physician? Do my doctors and I discuss this and he writes out a prescription? Because I'm actually coming to you saying that I need the shower chair and I need this lift to, you know, help me get out the bed and things like that. And or is it a recommendation? How is it actually covered? Because if you got a person that doesn't have anyone, this is our viewers. I'm home alone. What do I do?
Well, let's hope that they all have access to a cable in the Just Ask show. But all healthcare, as a rule, starts with the patient's a physician. But oftentimes, doctors are in their classroom education. They're not educated on things that happen outside of the hospital, their office, or a nursing home. So oftentimes a patient is sort of at a risk that they must find some way to find others out. So we provide a community education in the senior citizens buildings, in the churches, at health fairs, to provide the education and the access to companies like Crystal Home Healthcare.
Okay.
And I'm sure that your show also provides access to those.
Okay. Well, what we're trying to cover is the fact that a lot of times people think that they should go to the nearest drugstore. You go to your neighborhood drugstore and you want to get crutches, and the drugstore doesn't have any crutches, so to speak. So then you need to find a place to have crutches. Okay. But the crutches may not be listed on the prescription or something, so then you go to this place and you say, well, I need some crutches. How would they know that the cost is covered under the insurance?
Well, and that's really where companies like Crystal Home Healthcare come into play. Understanding that a drugstore is just that. Their main line of a business is drugs. And then they have the other items are there as a convenience. Well, Crystal Home Healthcare, we take a different approach. We have assembled all the services that a patient or loved one of a patient would need, and we bring those to the patient's home. And this is not a new concept, Marsha. You know, before 1900, physicians, 90% of the doctors in America did not attend a university. They learned practicing in their communities, in the homes of the patient. You know, I'm 48, and I was born in Mississippi. I was born at home. So home care was prevalent in Mississippi in 1950 or 7. And so, like most education starts at home, healthcare is no different. It starts at home, and companies like Crystal Home Healthcare, we're here to help educate the patient and the loved ones about you don't have to seek it through the emergency rooms of the hospital, nor through the pharmacies, where truly they're set up and geared to provide the services that they provide. Emergency of medicine, the emergency room, and drugs of the drugstore. But home health care, Crystal and companies are like
Crystal. Are you recommending that wholeheartedly that our viewers who have a elderly loved one or a disabled person seek out the services from a home health care provider to get the necessary equipment? Because a lot of people will go to the drugstore and say, well, they didn't have it. But
I think that.
But I didn't mean to cut you off, but I wanted to know, can they bring in their prescription of what it is they need and find out if this is covered, and if not, how to get it covered, or because I want to make sure that our audience understand the knowledge of a healthcare provider agency is to make sure that, hey, you don't have to spend any money out your pocket. You can't afford it.
Oftentimes you don't. Oftentimes the services and equipment are covered. You know, information in America doubles every 7 years. The internet is a key place to find information, and your doctor's office, and or shows like this, and companies like Crystal Home Healthcare. But you have to be willing to seek the information. You know, if you travel down the path of those in front of you, you're going to arrive at the same place.
Okay.
So the internet provides opportunities, a phone call to Crystal Home Healthcare or to your show provides answers and opportunities.
Okay. Well, I tell you what, Bob, we're going to take a commercial break, and ladies and gentlemen, we're going to come back with some more good information about home health care providers. We'll be right back. Okay, hold up. You're off camera. You can
I wish I could go back when I didn't need someone to do my hair, back when I could still say my husband's name, back when I could have called 911 but didn't, back when I first felt the warning signs of a stroke but did nothing. I wish I could go back, but I can't.
With a stroke, time lost is brain lost. At the first warning signs, take action immediately.
Okay, you're fine. All right. 4-3. And welcome back to the show. For those of you who are just now joining us, we have CEO and Chairman himself, Bob McPherson of Crystal Home Healthcare. He's here to tell us today, ladies and gentlemen, about home health care providers. Now, a lot of you are watching the show, and I know you probably got some pertinent questions like, well, I need a lift. I need something. You have to know that, like Mr. McPherson said, you have to be knowledgeable in some things, or better yet, just ask a question to your home health care provider or your doctor, someone that can help you get the necessary materials that you need. Now, Bob, let me say this. See, a lot of times what we're falling in the line of is that when you first sustain an illness, could be cancer, could be diabetes and things of that nature, or an accident, right. No one's home is equipped. Right. No one has an idea what they're going to need in their home, okay? So when they get home, people are just crazy about getting home out the hospital so fast. Should their family members, prior to their release of hospitalization, contact a home health care provider beforehand?
Absolutely. What happens in a traditional sense, a person has an accident or an illness and they're hospitalized. The hospital has social workers and nurses that will help make them a community ready. Now, the hospitals have companies that provide services like Crystal Home Healthcare provides. We would prefer that they bypass the hospital and use the independent community providers like Crystal Home Healthcare. But the discharge planners and the social workers at the hospital will help make them a community ready, depending on what it is that they understand. Now, they won't come out to the patient's home like a Crystal Home Healthcare will. Okay. Instead of the nurse in the hospital will, if someone is having a difficult time of walking, they will prescribe and arrange for them to receive an appliance that will either help them walk if they can, like a walker or a cane, and if they cannot, a wheelchair. But they won't take into consideration, as an example, how the wheelchair will ascend the stairs at the home. Okay. A call to Crystal Home Healthcare, and our nurse comes out to the home to evaluate, will uncover that the individual needs a ramp, and will also provide the ramp. So it's a situation that the other people in the hospital are limited in the information that they have, whereas the people out in the community at the patient's home, they're not.
Okay, so your facility is equipped with a staff of nurses and physicians that can go to the patient's home and actually to do evaluation. Is that considered evaluation of a person's home?
Absolutely.
Okay.
We will come out and we will assess the patient's physical needs and their homes of physical needs, and we will suggest solutions to their problems. Now, 99% of those problems that we uncovered are covered by insurance. There are solutions to those. Okay. Those that are not, normally we can find a grant money or do-gooders in our society that will help that.
Okay. Now, speaking of grants, because I know you're involved with some very heavy-duty organizations that do a lot of wonderful things, but I wanted to ask you about a grant you're mostly fond of. But before I get to that, we have some things on the table here that we must talk about, because I hear a lot about the new concepts of developments for diabetics. Right. Okay, and I have a few family members as diabetics, and I know that
we all do.
That's right. We take this serious. So I wanted to discuss some of these devices. Is there, now this one's called
the QuickTech.
quick tech. Okay, is this the one that when you take your blood, or how do you do this?
Well, all the monitors on the table work the same way. They need a sample of blood. Some require less than others. Like this requires the smallest amount.
Okay.
But they all require a sample of blood, a strip for you to put your blood on, and then a meter reads the result of it.
Okay, so this is like the meter reader.
Absolutely.
Okay, and then somewhere along this device, the blood drop goes on there. Okay,
Right.
I think my father has this one. I'm not sure. That's probably why I picked it up. I'm like, I've seen this
You've
one
seen
before.
that before, right?
Okay.
These are all popular meters.
And you're saying this is the less of the...
Right, that's the Freestyler Flash, and it's the world's smallest meter, and it requires the smallest amount of blood.
Okay. Now, when you say requires the smallest amount of blood, you have to... Is everybody still pricking themselves?
Yes, everyone pricks of themselves, but these alternative site meters, you don't have to prick on the fingertips, which is a sensitive situation.
Okay.
You can prick on your arm or your thigh.
Okay,
And,
okay. And so this one takes the least amount of blood because it's like the first time you prick yourself or whatever and the little drop comes up,
Right.
that'll work.
Right. Or for people who just have a difficult time bleeding.
Okay.
That's
Okay.
almost it.
Okay. Well, you know, I know this is a serious situation here when
Right.
you pricking yourself daily somewhere.
Right.
Okay. But does it matter where you prick yourself? This one, it doesn't matter where you prick
No,
yourself.
as long as you get
Yes.
blood.
Okay.
Right.
Okay. And is that for all the devices? That
No, some of them, because of the amount of blood that you need, you have to prick yourself on your fingertips.
Okay, okay. I mean, you know, I've watched my father prick himself, and he seemed like he handles it, you know, and I'm looking at him like, don't that hurt?
Right.
But
And it is painful.
oh, yeah,
Right?
yeah.
The fingertips.
Over
That's
and
the
over.
most sensitive spot.
Okay.
So, you know, it's painful.
Okay.
But the disease is a hideous disease, and you have to attest. The only way that you'll manage the disease is by testing. So you have to test.
Okay.
The number one goal of diabetics is to keep the levels are within a range that their doctor has determined, which is more normal for them.
Okay.
So you have to be under the care of a doctor. You have to attest, and then you should exercise, and you should have a reasonable diet. But you
Okay.
have to test, and you have to report the results to your physician or
now,
your nurse.
you know, we do have, I bet you someone at home is saying, well, what about if I don't have diabetes? How can I prevent getting diabetes? There's the pre and the pro and all that. So is there anything that, I mean, what would you suggest or recommend that if a person...
Healthy lifestyle.
Right,
So, you know,
right, that's right.
A healthier lifestyle, which is a reasonable diet and exercise. Because diabetes for most non-juvenile diabetes, the adult onset it comes as a result of a poor diet and poor exercise habits.
Okay.
So for all the couch potatoes in the audience, get up and walk.
Okay. I mean, because really, you know, people, a lot of times when you're coming into an ailment, you don't know you're coming into it, you're just tired.
Right.
Okay, you're just extremely tired, might have, you know, colds,
the
night
symptoms
sweats
are-
or something.
right,
Right,
right.
something's going on, and finally you go to the doctor and he says, well, you have the onset
Of
diabetes. Okay, but it can be controlled if you eat right and exercise. Okay, so is that to cut a person off from, like, if they eat right and exercise, they don't have to take the pill, or they don't have to
take insulin.
Okay.
They won't run the risk of going blind or losing a limb. The
Okay.
real ravages of the disease.
Okay.
And you know, and diabetes is the fastest growing disease in the U.S.
Yes, yes. Now the pill is when you actually start having diabetes, right?
Well,
When
some people start on the pill, some don't. Some,
Okay.
By the time they arrive at their physicians and they're diagnosed, they're too far along in their development where the pill will help, and then they're on insulin, the
Okay.
needle.
Okay, okay. So for those of you who are listening, keep in mind now, if you're feeling tired, exhausted, and all that kind of stuff, and you think you got
if
some...
you're urinating a lot, if you're tired,
Okay.
if you, right,
Okay.
those are signs.
Those are signs, okay.
Right.
A frequent urination and
And being tired.
being tired. How about...
Difficulty of sleeping, wounds that won't heal.
Okay. And I didn't know about the wounds that didn't heal and stuff.
Right,
So if you have
that won't heal.
a sore and it's just taking too long to heal,
Right.
when it normally takes about a day or two to get a scab on or something
Right,
like that?
and you're not
Okay.
getting in. You should go to your doctor.
Okay, okay. Now, ladies and gentlemen, for us to sit here and tell you this, we hoping that some of you will recognize that, you know, we're not here to scare you. We're not here to put you in fear, but we want you to check yourselves out and make sure that you are living a healthy lifestyle. And if not, do plan to live a healthy lifestyle. Don't wait till January, the new year, to say, I'm going to start exercising. You know, this is the time
Start now.
Start now.
Start today.
Okay?
Right.
Okay, so take it on the chin to get busy today and keep going. Because let me ask you this, I'm going to go to commercial break, but is sugar an issue with diabetes?
Absolutely.
Okay.
See, a refined sugar is.
Okay.
That's a problem. I mean, that glucose is the body's manufacturing of a sugar, and that's how our muscles are able to operate. They need energy, and the energy comes from sugar. Well, a refined sugar creates a problem because for a diabetic, it just dumps the sugar into the bloodstream, and the body can't
nowhere to go.
burn it up.
Okay.
So the sugar floats around, it clogs the arteries, it chokes out the muscles, it does all the things that cause us to have the problems.
So is Splenda a good sugar to have?
Well, Splenda is not a sugar, but but you know, if you must have a sweetener, here's a commercial. Yeah, that would be a good one.
Okay, okay. We're going to ask them to, you know. Okay. Well, I tell you, Bob, we're going to go to commercial break. Ladies and gentlemen, hurry back and join us. We got to finish up some more good information with Bob McPherson. Hurry back. How you doing? You all right?
Sun exposure starting in childhood is a major cause of skin cancer. That's why you should apply a high SPF sunscreen and keep your kids covered up whenever they're outside, not just at the beach or pool. Protect your children from the sun. They'll thank you for it someday.
And welcome back to the show. Now, ladies and gentlemen, we're having a real good conversation here with Bob McPherson, Chairman and CEO of Crystal Home Healthcare. And hopefully we cover some of your questions about history of diabetes and what to do, and then also just some home health care provider information in general. Now, we're going to talk about these shoes on the table, Bob, because I know people are like, why do they have a table full of shoes? So I wanted to ask you, tell us something about these shoes, because I'm looking at a variety of shoes and styles.
Well, let me start by saying the federal government are determined that with a diabetes, an ounce of prevention was worth a pound of cure. So they implemented the Diabetic Shoe Act. And what it says is that a person who has a circulatory problems, they will purchase a diabetic shoes for them. And what happens with these shoes, and they're all stylish, but the government will pay for a pair a year.
Okay. And
the mindset of the government is that an amputation costs $41,000 plus the ongoing care of someone that has been made disabled.
Okay.
The shoe, which they'll pay $140 for, I think, will reduce the likelihood of the need to amputate.
Okay.
So, as a conscientious provider in the community, we carry a full complement of diabetic shoes payable by the government, Medicare.
So this is a prescription shoe?
A prescription shoe for diabetics.
Okay, and a person can come to your facility and or any home health care provider mainly.
Well, most don't carry them.
Okay.
But Crystal, a one-stop shop.
Okay.
Carries the shoes.
Old famous Crystal carries shoe. Okay, so and I see you got wide variety. So is it male and female version?
Male and female.
Okay, and the white shoe, is that a
gym shoe?
Gym shoe?
Right, it's a gym shoe.
Okay.
And what happens are the shoes promote circulation in the feet and in the legs.
Okay.
And it reduces the likelihood of an amputation.
So a person can wear this gym shoe, still walk, jog, whatever they're doing. Okay, and it's doing something medically to their leg or muscle or...
Well, they're custom fitted. So
Okay.
unlike a shoe that you would purchase off the shelf,
Okay.
which rubs your corns and calluses
Okay.
and causes infections and gangrene and those things that lead to amputation, these are custom fitted to the individual, and they don't promote those problems, and
Okay.
they cure them. Well, I shouldn't say
Nice.
cure. I can't say cure.
No, you can't say
but they do
Aid in prevention.
in the prevention.
Okay, this is a nice gym shoe, ladies and gentlemen.
Right.
So, okay, so it's a prescription shoe. Okay, and the person comes in with their prescription, decide.
Or they can call us and we will contact their doctor and get all the necessary paperwork, come out to their home and do their fittings and handle all the insurance and paperwork and everything.
Okay, you guys are good. Okay, now you are involved in. I meant to go back to it because I want to talk about the brochure, but you're involved with a grant.
Yes.
Okay.
We have a grant. I am a diabetic.
Okay.
And 10 years I set up a grant program where we donate 5% of what we collect off diabetic supplies. And when patients contact us who have no insurance and no ability to pay, we cover the cost of it. And the monies are spent on a first come, first served kind of basis. So, and to qualify for the grant, you must be a diabetic and under the care of a doctor.
Okay.
There are no
Now,
income requirements or none of those.
You know somebody at home saying, "How do I get that? How did I get that information?" No, you got a phone number.
Yes, 1-800-493-4902.
Okay. Okay, we're going to flash that number. So that's if a person, once again, that's a grant.
That's a grant.
Okay, and the person is eligible by means of no
A doctor and diabetes.
Okay, they have to have diabetes.
And have to be under the care of a doctor.
Have to be under the care of a doctor. Okay, and no income, no or low income.
No, if a doctor says that they cannot afford the supplies, then we give them the supply. It's not. We're not trying to pry into their personal information. We would hope that everyone who claims to be indigent are in fact indigent. You know, in America, we don't want to run around saying we're poor. We're not poor.
Okay, okay, you're right. Okay, okay. Well, that's good. That's really good. Now, let me ask you about this brochure here. I like this. Is this something that you guys pass out?
Well, we pass
or
that
mail out? What do you do?
We pass it out. We mail it out. You can contact the office, visit our website, come in the store, and get all those that you want. You know, they're free.
Okay, okay. So this information here is actually...
It talks about the insurances that we accept.
Okay.
And the services that we provide.
Okay, okay, this is nice.
So,
this is nice. Because people, you know, they get confused when they go to a home health care provider and they just go in for what they think they need and come right back out. Yeah. But you guys actually provide literature.
Yes, there's a walk-in, a showroom. There are nurses available there to help develop a care plans for them, so that if they don't know what they need, a call to Crystal Home Healthcare, we will put together a plan of care that is disease or a diagnosis are related, and what their particular insurance needs are, and what their particular living situation is.
Okay, that's great. Okay, now once you give out that number again,
1-800-493-4902.
Okay, okay, and that is for the grant. Okay,
Yes.
okay. Well, I tell you what, Bob, I really enjoyed having you here, and I know you're going to get a flood of calls or emails because our viewers are like, I got some more questions, but we're running out of time.
Well, hopefully you'll have us back.
Okay.
Thank you.
I do ask you to come back. Okay, thank you. Well, ladies and gentlemen, you can't get any more knowledgeable than this today. I mean, you know, you're going to go to your own chosen healthcare provider, but keep in mind that Bob McPherson of Crystal Home Healthcare covered a lot of information. And so if you have questions for Bob and his staff, please feel free to give us a call at our station, 248-988-0250, 248-988-0250, or check out the web, justasktalkshow.org, and find out more about Bob McPherson and Crystal Home Healthcare. If it's a guest that you want to see or have not seen yet, drop us an email or give us a call. Either way it go, we like to cover all information for you. So we want to thank Bob again for coming, and if you have a future question for him, call me. I'll send it to him, I promise. I'll send it to him. Okay, well, what do I always say? I'm your host, Marsha Florence, and you know what I say. If you have a question about a person with a disability, don't be afraid to ask, and if you have a general question, you should ask that too. I'm your host, Marsha Florence. Thank you.